Hello everybody. Today I am going to talk about Pertussis. It is a bacterial infection caused by Bordetella pertussis and Bordetella parapertussis bacteria. It is 100% contagious. That means patient need isolation. Incubation period is 1 to 2 weeks. It is spread by respiratory droplets and no age is immune. That means it can occur at any age. Now, classic pertussis has three stages, namely catarrhal stage, paroxysmal stage, and convalescent stage. Now, catarrhal stage. Catarrhal stage persists for 1 to 2 weeks and it is characterized by fever, coryza, sneezing, conjunctival congestion, and lacrimation. Now, paroxysmal stage, it persists for 2 to 6 weeks. And the hallmark of paroxysmal stage is characteristic cough. There is uninterrupted cough with single exhalation. There may be more than one episode of cough per hour. In paroxysmal stage, patient has no fever, no malaise, no myalgia, no rash, no sore throat, no hoarseness of voice, no wheeze, no rails. That means patient is completely well and during coughing episode, tongue protrudes, eye bulges, face become flushed or red, and loud whoop after coughing stops occurs. That's why pertussis also named as whooping cough. And posttussis emesis is common, especially in children. Now the third stage, which is convalescent stage. It persists for more than 2 weeks. In this stage, gradually the severity and duration of cough episodes diminished. Now, a very important point, do not diagnose pertussis unless characteristic cough do not persist at least 2 to 3 weeks. Now, diagnosis, it is mainly a clinical diagnosis, but some laboratory test can help to diagnose pertussis or whooping cough. In complete blood count, you will get absolute lymphocytosis, and if you do nasopharyngeal aspirate culture and PCR, you will get positive result. If you do a chest x-ray, you will get no parenchymal involvement except perihilar infiltrate. Patient needs quiet environment. Feeding after coughing episode is better. A small volume feed is given as posttussis emesis is common. Azithromycin is the treatment of choice. Alternative to azithromycin therapy is trimethoprim sulfamethoxazole. Patient needs isolation and treatment of household contact with similar antibiotics necessary. As I mentioned, it is 100% contagious. Now, how long patient should be isolated? When you start antibiotic azithromycin, patient should be isolated until 5 days of azithromycin therapy. Now, complications. Apnea occurs in small children. Pneumonia and otitis media can occur not due to pertussis but due to secondary bacterial infection. Patient may develop pulmonary hypertension and some complication occurs which are related with cough. These are hernia, epistaxis, subconjunctival hemorrhages. Now, how to prevent pertussis? By vaccine. If patient age is less, patient will suffer more fatality. That's why preterm baby has highest mortality in pertussis. Thank you all. Please don't forget to subscribe.